Myself Raju Poojari. I am coming from here Jaipur, from Hyderabad for the pharmaceutical meeting purpose. And the 16th evening I have affected for the chest pain. So as per the friend suggestion, I visited this hospital. So after visiting this hospital, Dr Kush sir was taken very nicely, very friendly nature. I feel it's a homely type. It's not like a hospital. The service also very good. The food quality is good. I don't feel anything. There is no my family friends are with me in during this situation. They are like treat as a family member. I'm very much happy with this service and quality and cleanness, maintenance, to interact the patients and time to time the service. I'm very much happy to this hospital, and thank you, special thanks to Dr. Kush sir to survive me. Now I'm very happy. I'm very happy to go to my native place to Hyderabad. Thank you.
Yeah, my name is Dr. Naresh Thaduri. I am associate professor and anatomist, and he's Raju Poojari, my brother-in-law. And he said in the last week, I think Sunday, we discussed in phone, and he telling about some pain in his chest region, and we thought he lifting some weights and home, and I advised him to, I think it is a muscular pain, just to take the flexor MR, it is a muscle relaxant. Then he will took the tablet. After 2 days, 3 days, I think it is around the Wednesday, again he called me and he told about the pain is increases. Then I said, you better to you take medicine, and first you visit hospital and check about your BP, and you take one ECG. They were discussed lot. Finally they advised two options, one option for the stent and second option for the open. If we implant, with the chance, then we are implant one more stent in the ramus, but the God grace, it does not happen, and they are enlarging with the balloon, and they are applying some techniques, and now it is a free, and my Jiju also now is clear, and my brother-in-law don't having any problem right now, and is settled now. So thank you so much for Kushi sir and entire team of this hospital. Thank you.
Hello, I am Dr. Bhagat, presently working as an associate director in Internal Hospital. As Dr. Poojari said, he actually had a heart attack day before yesterday night, and his CPR was done. He had a cardiac arrest, and his CPR was done, and he was revived after CPR. He came to the emergency. He was having chest pain, but pain was quite settled. So we decided for an elective procedure, and next day when I did the procedure, there was a tight lesion in the distal left main and posterior LED, and there was the blockage in the mid LED as well. So definitely whenever we have a lesion in the left main, we always give option of bypass as well as angioplasty. But since he was very young, family also, I and other cardiologists also, we had a common consensus decision that we will go for angioplasty. But the question was that we had to implant two stents, one from left main to LED and one in the mid LED. So here came the decision to put a absorbable stent. So usually, as we all know, that there are various kind of stents which are available. In the early days, we had a bare metal stent with no drug coating over the stents. So we call it as BMS. But then the technology evolved, and gradually we had drug-eluting stent, which we call it as drug DES. So the advantage of drug-eluting stent over bare metal stent was that the chances of reblockage in the stents were far less as compared to the bare metal stent in drug-eluting stents. But then the problem was that there is a permanent metallic tube which is present in the vessel when we implant a metallic stent. So that is why we took a decision to implant an absorbable stent in the mid portion of the LED, which is one of the artery which was blocked. So what is absorbable stent basically? That over a period of 1, 2 years or 3 years, this stent will gradually absorb, and after 2 years, probably after 2 or 3 years, when we will do an angiogram, so that vessel where we implanted an absorbable stent, that will look absolutely normal like the normal vessels. So this becomes very important, especially in young patients, especially in those patients in which we had to implant in the distal vessels, because if at all in future we need to do a repeat angioplasty or a repeat bypass procedure, then it becomes very easy if there is no stent over there, rather than if there's a metallic stent over there. So keeping all these things in mind, we decided to implant a absorbable stent in the mid-LED portion and a drug-eluting stent from the left main to LED. And we did the procedure. We used an imaging technique also, because since it's an absorbable stent, we can't even view it in the X-ray films. We had to use special imaging technique. We used an optical coherence tomography, we call it as OCT, which is kind of sonography, which we go inside the vessels, inside the artery, and we can exactly see about the stent expansion, whether stent is properly opposed to the vessel walls or not. And normally we can see it in the X-ray, but especially in this case of absorbable stent, we had to use that maneuver. And when we did that, the stent was very well expanded. We had very good results in the absorbable stent as well as in the stent which was implanted from left main to LED. The procedure was successful. It was done yesterday. He has been shifted to room, and probably today evening he will be discharged and he'll be going back to his next native place. And thank you for trusting me. Thank you.